Hello, I'm here to talk about von Willebrand's disease. Von Willebrand's disease has multiple types and subtypes. Type 1 and 2 are autosomal dominant, which means you only need one parent to pass on the gene to have the condition. However, type 3 is autosomal recessive, meaning both parents have to pass on to the gene for you to contract it, and is also the most symptomatically severe. Pathophysiology. The condition is caused by a clotting factor deficiency called the von Willebrand factor, which is the most common blood clotting and bleeding disorder. The clotting factor helps platelets clump together and adhere to the vessel wall at the site of an injury. Risk factors include it's mainly one non-modifiable risk factor, which would be inheritance from parents. So parents are the primary risk factor. If someone has the gene, they have about a 50% chance of passing on to their children. Major signs and symptoms. Von Willebrand's disease is a clotting disorder, so the most common and consequently the most severe symptoms are related to bleeding, which is prolonged due to the lack of the factor. This includes the presentation of a rash, bruising, and any other skin-related symptoms. So the major signs and symptoms include skin rashes, heavy menstrual bleeding, excessive bruising, oropharyngeal bleeding, epistaxis, or nosebleeds, post-dental procedure bleeding, and post-surgical bleeding, and just excessive bleeding from wounds. Diagnostic testing. According to Weyand and Flood, 2021, screening assays such as CBC and partial partial thromboblastin time, APTT, and prothrombin time are likely to be normal in most patients with von Willebrand's disease, and thus are of little utility. So the diagnostic testing, platelet function assay. The platelet function may be utilized during diagnostic process and during treatment for monitor the treatment's effectiveness. The abnormal findings would be platelet blood vessel interaction defects, which would indicate multiple hemolytic conditions, including Cushing syndrome, Henoch-Schönlein syndrome, uremia, and von Willebrand's disease. Second test would be factor VIII clotting activity and coagulation factors concentration. This measures the quantity of each specific factor that defects in homeostasis. Factor VIII complex is a complex molecule with two components, the first being related to hemophilia A and involves the homeostatic mechanism. The second is the von Willebrand's disease factor. The factor gene is a key player and responsible for detecting pathogenic alterations with this gene. The next test is the platelet aggregation test, ristocetin. Ristocetin is the most commonly used to induce platelet aggregation, and adding this product to the patient's blood can help differentiate the disease affecting platelet aggregation. Abnormal findings would be a hypoactive aggregation of platelets, would indicate multiple congenital conditions, including von Willebrand's disease. Prothrombin time. Prothrombin time determines the effectiveness of extrinsic system and the common pathway of the clotting mechanism. It determines the clotting ability of factors 1, 2, 5, 7, and 10. When these factors exist in deficient quantities, there's a prolonged prothrombin time. Normal findings would be approximately 11 to 12.5 seconds. Abnormal, anything greater or equal to 20 seconds would be considered critical. partial thromboblastin time, PTT, or activated partial thromboblastin time, APTT. Just like PT, this test commonly used in practice to monitor end-stage liver disease and oral anticoagulant therapies, so that although the effectiveness, it shows the effectiveness of the intrinsic system and the common pathway of the clotting mechanism, it determines the ability of the clotting factors 1, 2, 5, 8, 9, 10, and 11, and 12, but would not differentiate your diagnosis.